Assalamualaikum, I bid to everyone. My name is Aimar Danish bin Helfy Khairul, and today I will be presenting about cardiology. So, as we all know, the heart is one of the most vital organs in the human body. It works continuously from before we are born until we die. So, understanding how it works and how it can also fail is the main goal of cardiology. Now, let's move on. What is cardiology? Cardiology is a branch of medicine that focuses on the study, diagnosis, and treatment of disease and condition related to the heart and blood vessels. The study in cardiology also includes the study of the heart structure, heart function, blood flow, and also the electrical activity of the heart. A cardiologist is a doctor who diagnoses and treats heart conditions such as heart attack, heart failure, arrhythmia, hypertension, and congenital heart defects. Cardiology is extremely important because cardiovascular diseases are the leading cause of death worldwide. When the heart fails, the entire body is affected because oxygen and nutrients cannot be delivered properly. Now, let's talk more about the heart. So the heart is a double self-adjusting suction and pressure pump, and and the heart is also divided into the right and left. So the heart contains four chambers, which is the right atrium, right ventricle, the left atrium, and the left ventricle. The right side of the heart receives deoxygenated blood from the body and sends it to the lung. The left side of the heart receives oxygenated blood from the lung and pumps it to the entire body. The heart is divided by a wall called septum, which prevent mixing of oxygenated and deoxygenated blood. The heart also contains four valves, which is tricuspid valve, pulmonary valve, mitral valve, and aortic valve. These valves open and close to ensure that blood flows in one direction only. The heart muscle is called myocardium and it needs its own blood supply. And this blood supply is provided by the coronary arteries, which are very important because blockage in this artery can cause a heart attack. So, how does heart works? So, heart works in a repeating pattern called cardiac cycle, and this cycle has two main phases. The first, where the first phase is diastole, which where when the heart relaxes and fills with blood, and then it goes into systole, which is when the heart contracts and pumps blood out. So the heartbeat is controlled by an electrical impulse. This electrical impulse start in the sinoatrial node, which is also called the SA node, which is the natural pacemaker of the heart. Then the electrical impulse spread through the atria, causing them to contract. Then it passes into atrioventricular node, wi- and it delays or and it delays it in atrioventricular node, and then it will pass into the ventricle, which making them to contract, and this will produce the heartbeat. So the blood circulate through two systems, which is pulmonary circulation and systemic circulation. In a pulmonary circulation, blood goes from the heart to the lungs to get the oxygen, and then in the systemic circulation, blood goes from the heart to the rest of the body. This continuous circulation keeps every cell in the body alive. Now, let's move on to one of the example of the disease. So, one of the example of the disease is atherosclerotic cardiovascular disease, or in short form is ASCVD. So, what is ASCVD? ASCVD is a disease where it involves plaque buildup in artery walls, and the symptoms can be shortness of breath, chest pain, pain in back, shoulder, neck, arm or belly, dizzy or lightheaded, heart palpitation, fatigue, and nausea. A heart attack can occur when a plaque break open and a blood clot forms, blocking the artery completely, and then the heart muscle then dies due to the lack of oxygen. There are several risk factors for arteriosclerosis, which include high cholesterol, smoking, diabetes, high blood pressure, obesity, and also lack of exercises. So many of these risk factors can be controlled by a healthy lifestyle. Now, let's move on to I want to talk about a specialist which her name is Dr. Masliza Mahmud, and she is from Batu Pahat, Johor, and she is 52 years old. So why I want to talk about her is because of her achievement, which is on July 2022, Dr. Masliza became the first Malaysian woman to become an associate professor at Oxford University. So this has been uh, so this she is famous for this, and it has bring a great name to our country. She's also especially known for her research into how the heart muscle changes in diseases like heart failure and cardiomyopathy, which help doctors diagnose problem earlier and treat patient more effectively. So Dr. Masliza's success shows that Malaysian doctors can contribute not only locally but also at the global level in advancing cardiology. She is a strong example of how cardiology combine clinical care, technology, and research to improve patients' life. So that is all from me. Thank you.